Okay.
Go. Flying through it.
Ladies and gentlemen, would everyone please stand for the pledge? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, I'd like to bring this Wednesday, December 19th Salary Board to order at 1:15 in the Commissioners' Conference Room. Can I have a motion for the approval of the minutes?
I'll make a
Can I have a second?
second.
All in favor? Aye. Opportunity for the public to address the board on agenda items only. Okay. Johnny, we're going to go, let's do the simpler ones first to get them out of there first.
Yes, Commissioner. Well, why don't we start with the IT, Information Technology, motion to create a position of database administrator at a salary of $45,000. Here is Jeff Mando.
That's the
Jeffrey?
simplest one?
Yep. No,
Oh, I thought
not the simplest one, Commissioner?
that Evie was actually the,
Well,
I thought I was the most simple.
do I have to answer that? We'll do you next, Evie. Evie's next on the list.
okay,
Evie, you're second.
Never the most simple.
okay. We have a motion to create a position of database administrator, salary of $45,000.
Jeffrey?
Good afternoon, everyone. Part of my appearance, I'm in the middle of packing, as with some others are. This new position will be for Human Services. With the growing need to maintain required applications and the recent acquisition of drug and alcohol, it's becoming difficult for one technician to keep up.
We'll do Mark.
The position will be funded by the Youth and Family Services and will be absorbed within their approved budget. CYS has an open position at $64,414, which will cover the requested salary of starting $45,000. Therefore, no additional funding is being requested. The elimination of this fiscal position and the creation of the IT position would result in a budget reduction of $19,415, and the position's also state reimbursable by 80%.
Okay. Does the board have any questions? Okay. Jeff, would you like to make the motion?
No, why are we creating this for who?
It's an additional position for Youth and Family Services, or Human Services in general, with the need for more help over there. We have one individual over there now, and it's just not cutting it anymore. They're progressively moving forward, and we need additional help over there, and it's also covered financially, so.
The state pays for
Would
this,
you like to
correct?
get up,
Yeah.
Bill, for a second? Quick.
Is this the one where they were retired? No, this is Barb Durkin. Okay, I have the wrong one.
Are you good, Commissioner, or do you have any questions? Why?
I have no question.
The
Lorraine.
position that the Commissioner, the reason that we're asking, currently we have one who is, in addition to doing all the technical work and maintenance work, he's also responsible for all the application development. We're coming out, we have a new system, some of them are state mandated, that he's also responsible for coordinating. And so at this point, he is an app developer, a database manager, and a technician, and basically on a floor with almost 200 people, it's become almost impossible for him to keep up with the work. If you see him moving on the floor, it's somewhat crazy at this point.
Okay. All right, thanks.
I think.
Okay, Jeff. Okay. Jeff, would you like to make the motion?
I'd like to make a motion to accept the position of database administrator.
Do I have a second? All in favor?
Aye.
Aye.
I'll say aye,
Okay.
since Bill says.
Okay, next up, we have Recorder of Deeds, motion to accept the salaries as presented in the 2019 budget. Here's our Recorder of Deeds, Evie Rafalco McNulty. Evie,
Thank you, Commissioners. I'd like to
make a
make a
motion.
motion to accept the salaries as presented in the 2019 budget.
Okay. Does anybody have any questions?
Thank you for all your help, Evie,
Oh, thank you.
throughout the year. Every time I came to you and asked you for something, you had it ready for me, so I appreciate that, and thanks
Thank
for
you. I
working with
appreciate you
us.
acknowledging that. Thank you.
Yeah,
We have a motion on the floor. Do we have a second?
second.
All in favor?
Aye.
Aye. Okay, you want to just go right to Maury Kelly?
Maury Kelly, Clerk of Judicial Records, motion to accept the salaries as
Clerk on the
presented in
move.
2019. Maury?
Start smiling.
Hi,
There you
good
go.
afternoon, Commissioners. Just like to make a motion to accept the salaries for 2019 for the Clerk of Judicial Records.
Okay, does anyone have any questions? Okay, can I have a motion?
So moved.
Can I have a second?
Second.
All in favor?
Aye.
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 Thank you very much.
Thanks, Maureen.
Next, we'll move,
Yes.
next we'll move to the coroner. Tim Rollins. Tim, a motion to accept the salaries as presented in the 2019 budget for the coroner's office?
I make a motion
Can I make a
to
motion?
accept the salaries as presented.
Do we have any questions for our coroner? Okay, do I have a second?
Second.
All in favor?
Aye.
Aye. Thank you.
Thank you.
Merry Christmas.
Aye.
Next, we'll do the controller. Gary, a motion to accept the salaries as presented in the 2019 budget for the controller's office?
Yes, members of the salary board, I make a motion to accept the salaries as presented in the controller's 2019 budget.
Does the board have any questions for Mr. DeBillio? Okay, can I have a second?
Second.
All in favor?
Aye.
Aye.
The sheriff, we'll do the sheriff's office next. Motion to accept the salaries as presented in 2019 budget. Sheriff McAndrew.
Good afternoon, Commissioners. I make a motion to accept the salaries of the Sheriff's Office for the 2019 budget.
Does anybody have any questions for the sheriff? Do I have a second?
Second.
All in favor?
Aye.
Aye.
Next, we're going to do the Register of Wills, to accept the Register of Wills office salaries. Fran Kowalski is not here. She is moving. She sent an email. She was unable to attend because her office is in the process of moving to the new building. So can someone make the motion for her?
I'll make a motion to accept the salaries in the Register of Wills 2019 budget.
Okay, do I have any questions? Do I have a second?
Second.
On the motion? Yeah. All in favor?
Aye.
Aye.
We have the courts, but why don't I do the courts with, Frank, why don't you do the courts to accept the salaries in the 2019 budget? You want to do that, Frank?
Good afternoon, Commissioners. On behalf
afternoon.
of the courts, I would present a motion to accept the salaries as listed in the 2019 budget for all court departments.
Does anyone have any questions for Mr. Castellano? Okay, can I have a second?
Second.
All in favor?
Aye.
Aye.
Thank you.
Okay, they're the easy ones, Commissioner. Now we'll get into the more detailed ones. Let's do drug and alcohol is next on our agenda. We have a motion to, two motions. Motion to create a new position of a certified recovery specialist at a salary of $26,000.
1 second, did Judge Brace have to be somewhere?
Oh, I'm sorry, Judge. Oh, I
The judge
didn't
might
see you
have
here.
to
I'm
be
sorry,
somewhere.
Your Honor.
Judge,
Okay,
actually,
you want to do the
Judge,
court?
Did you? Come on,
Oh,
Judge.
come on,
would you
Judge. We'll bring
forward?
you up. I'm sorry, Judge. I didn't see you sitting there.
Sorry, Barb.
Sorry, Barb. Okay, Judge.
Good morning.
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 As you're aware, on the agenda, there are 3 different items that are listed. One is a motion to change the title of probation officer aide to office manager. As we have discussed, the time of closing the detention center, we had a number of issues that we had to deal with in regard to the juvenile probation office. One is in regard to in which the supervision was completed, both in our adult probation department and our juvenile. When we were reviewed, it realized that there was no office manager, no one to really manage the staff that was involved there. And so this would be a motion to elevate one of the officer aides to the office manager position so that the office can run smoothly. The second would be in regard to changing the acting director, which was Cindy Cummings, who was the acting director, and at this time, with the retirement of Mr. Clifford as the chief of juvenile probation, that she would be moving into that role. There are also the
Do we have to do them one at a time, or we can do them all at once, Donnie?
We can do them all at once.
Okay, good, okay. Go ahead, Judge.
and also in regard to the juvenile thing, how there would be a the acting chief is moved out. The other position would be to take a juvenile probation officer, and not a new position, but a change in their designation to deputy chief, so that there would be somebody besides the actual chief to be running the office. This is in compliance with the JCJC rules as well as adult probation.
Okay.
Any
Okay, what's up? Does the board have any questions for Judge Brace? Okay. Judge made the motion. Can we have a second?
Second.
All in
And just to
favor?
clarify, this will be a motion to adopt items 18-3043, 3042, and 3041. So we'll do all three
Yes.
at once. Yes. Okay. Sorry, go ahead.
Okay.
And then
All in favor?
Aye.
Aye.
In regard to adult probation, there are two items. One, obviously, to accept the salaries as presented in the 2019 budget, and the second is the creation of 4 adult probation officer positions. We have sat with Mr. Durkin in regard to reviewing the analysis of this. We looked over the last 2 years from the time that their pretrial operations have been put in place. The reduction in regard to the county prison population has been approximately 160, I think it's 158 the total, for those 2 years. Just the analysis of what that savings is for the county is obviously several $1 million in regard to savings. What we are looking to do now is to further implement that, to be basically doubling our pretrial staff, so those especially that are afflicted with drug and alcohol issues and mental health issues will be assessed within the first week of the preliminary hearing and immediately placed on pretrial programs. We are looking to expand the use of our treatment courts to take care of that. The second part is the other 2 would be for basically the prison population, because a review of our AGNON, or what they call GAGNON hearings, the violators for probation and parole, indicate that those individuals are out at the prison for approximately over 90 days. So that's strictly the ones that are drug and alcohol. For last year, there was as of December 4th of this year, it was 542 probation violations, of which over 62% were drug and alcohol technical violations. So our hope is by having 2 officers assigned to them, we are going to have the assessment that week. Either myself or Judge Giroulo will be doing by video conference within 2 weeks, having that person placed, whether it be in for treatment or whether it means an increase in regard to their supervision out on the street. Why then do we need 2 more people? When the state probation people came in to review our probation department, our numbers, as was given to Mr. Durkin and the commissioners last week, indicate that we are at least on the adult side 3 times more probation officers per officer than the state regulates. So we are way out of compliance. We can't put anyone else on supervision because those positions are way overtaxed. There are several other moving parts to this, but that basically is where we're at. So I make a motion that both those be accepted.
Okay, so that'll be 2 probation officers we're talking about?
Yes, there's 4 here listed.
That's 4, that's the typer.
No, it is 4.
Is it 4?
There's 2 pretrial.
2 pretrial
and 2 for the gag.
Okay, that's the gag 9.
Right.
Gag 9, okay.
You're doing them at once is what you're doing. You're
Okay,
combining them
yes, I don't know
together.
if they're separate
We
or not.
usually talk this 2 and 2,
I
right?
don't know if we have the title, because I thought they had different titles. Okay.
Well, they're going to have different titles on the spreadsheet. They will.
But the salary, we're okay.
Correct. Yeah.
Okay. The judge made the motion. Does anybody have any questions for the judge?
I do. I mean, I support the initiative. I just have a question on how this works. So, are you seeing less in prison and because of the pretrial? Can you explain that?
Correct. So the pretrial, essentially, Commissioner, is when they're at the magistrate's hearing, at the preliminary hearing at Central Court in the courthouse, we have the pretrial person right there, and the magistrate is then able to say, instead of the person remaining in jail, and saying, okay, we're going to give you bail, however, you must report to pretrial service. So that individual, instead of being out at the county prison, reports, sometimes daily. They're on the color system every day. They have to call in. If their color gets called, they have to come down. They also have to come down with evidence of their treatment, what they're doing, what work they're doing. So we can see a direct correlation in regard to the number of people we're seeing and the number of people that are not in prison. So we really believe that we can double that. It's going to take, obviously, over a year to get that done. But if you follow the numbers that we gave over the last 3 years, is what we've done, we believe we can double that savings, which in of itself pays for all 4 with, I think it was 1.5 million is the reduction, not based upon the per day, but a reduction of the per day, a conservative amount by Mr. Durkin. And I think it'll be also save some lives.
Okay.
Well, thank you. Now, does that happen prior to them going to prison, or can that happen when they get arrested, or how does that?
Well, the way it's working right now, Commissioners, for the most part, they are going to the prison first. So they get arrested, they go to the prison. 7 to 10 days afterwards is when the preliminary hearing is being held. Could some of the people be moved into the program beforehand? Yes. However, the reality is often when they pick up these individuals, they may be high or the situation at the time, the magistrate is not fully informed as to the person's background. So couldn't, for the risk to the community, can't really make that determination that, yes, we can move the person to pretrial rather than jail. So by the time we roll around to Central Court 7 to 10 days later, Central Booking and the Probation Department now has reviewed the record, looked to see what his history is, and also we have the ability to talk with the defense attorney at that time so we can make a better informed decision as to whether that person is eligible for pretrials.
That's kind of what I was looking for, is when do they become eligible and how does that work?
So that works within the 7 to 10 days as soon as the preliminary hearing is set up.
After they're arrested for?
Correct.
So do you look at every arrest, Judge, or is it just specific ones?
No, this will be strictly ones, obviously, if it's a heinous crime, the person's not reviewed for
Okay.
pretrial. If it's a drug and alcohol, always, and then often those mental health cases, and those cases that really, the penalty's not going to be that great to begin with, so we'll be looking at putting them into pretrial services and hopefully have that be their penalty at the end.
Okay, thank you for explaining.
This is going to give us more opportunity for probation to be able to spread out the duties that are done over there. And I know that the jail itself, this is going to be very, very helpful with getting the population through the prison much faster, getting them back on the street, people back with their families. So I think this can work
Well, I
out
don't know
very
if
well.
that's a good thing, putting prisoners back on the
No,
streets.
no. A lot of times things are being held up, and there's a lot of things. Judge, am I right? There's a lot of things that are just being
There's
held up by
also,
time.
one of the things that we're looking for often is, for some of these people that have a drug and alcohol violation, if we can get them into treatment
Yeah.
and get help, yes, we do want to get them back out, especially those that have families and are productive, they're working, and now all of a sudden, if they have to wait 90 days to get back to
They
work.
lose everything.
They lose them, and then often children are being placed with CYS, they're losing their apartment, so, and especially
Their
those
house,
that are suffering
craziness.
from addiction and mental illness.
Yeah, it's going to get busier now because they're putting some marijuana shops downtown, I see. So what are you going to do with the DUIs arrests for that?
Well, really, that is somewhat covered, Commissioner. The verbiage under the DUI is incapable of safe driving.
But how do you
It doesn't
know?
matter whether you are on a approved controlled substance or if you have an illegal substance. So the fact is, if marijuana, even if it's approved to be used and you have a medical card, does not mean that you necessarily can be driving, because if you're incapable of safe driving, for example, tomorrow a doctor gives you Valiums or oxycodones, doesn't mean you could be driving. So the classification really isn't going to change. What we have experienced in places like Colorado and Washington is a huge increase in regard to DUI and DUI crashes, though. So that, is something that obviously law enforcement and the DA are going to have to address, and ultimately the courts have to deal with.
Okay, so then we are going to see an increase as Colorado did, I would assume.
There's no reason, if we follow the research from those places in which both medical marijuana and legalized marijuana, yes, we'll see an increase in regard to our DUI population.
Okay.
Thank you, Judge.
Thank you, Judge.
Sure. Okay, I need a second. No, he made the
Got a
motion.
second, yeah.
Okay, all in favor?
Aye.
Thank you very much,
Thanks,
Commissioners.
Judge.
Have a
Merry
happy
Christmas.
holiday.
Merry Christmas.
Next, we're going to bring up the District Attorney, Mark Powell. He has three motions. A motion to increase the salary of the Scranton Housing Attorney from $50,430 to $54,500. A motion to create a position in Central Booking Unit Shift Supervisor at a cost of $30,468. And a motion to accept salaries as presented in the 2019 budget. Mark?
Good afternoon again. The first motion, 183039, is the issue addressed before the Commissioners this morning. It is a position fully funded by the Scranton Housing Authority, and I'm hereby formally requesting a motion to increase the salary to $54,500, again funded by the Scranton Housing Authority.
Okay, can I, on the question, does anybody have any questions for our
Is
district
that an
attorney?
increase?
It's an increase from $50,430. Yes.
I mean, was that what we voted on this morning, is what I thought you just created? Okay, I'm confused. It's been a long day,
The vote this
sorry.
morning, Commissioner, was to extend the contract for a year.
That's what it is.
The request now is to the increase, but again, fully funded by the Scranton Housing Authority.
Great.
Right. Money comes from the Housing Authority.
Okay, we have the motion. Can I have a second? Okay, all in favor?
Aye.
Aye.
I'm just going to abstain on it, because
Second motion is 183040. which is to create a position at the rate of $30,468 with no benefits for the central booking unit. This will be funded by proceeds from the central booking unit as well as surplus from the budget. However, it provides an opportunity to have a supervisor and not an independent contractor to cover all but one shift, 20 of 21 shifts. And currently, we do not have a supervisor in in 5 of the existing shifts. So this, I believe, will allow me to cover all shifts with the supervisor.
And currently, Mark, this person is already there working under a voucher. We're just going to move him from voucher to
That's
salary.
correct.
Yes.
And honestly, it probably will end up being the same salary
As
at
he's
the
making
end
a
of the day.
voucher. Yeah.
Okay.
So I hereby move for motion 183040.
Okay. Do I have a second?
I don't understand
a
how we
question.
could do that when we have all these employees without providing, does he work 40 hours a week?
He's covered under benefits from a previous position.
Oh, so he does have benefits.
He has health care benefits funded outside the county.
Okay, thanks. That's what I was looking for. Thank you.
Okay. All in favor? Aye.
And the last motion, 183034, is a motion to accept the 2019 budget as proposed.
Okay, I have a motion. Do I have a second?
Second.
All in favor?
Aye.
Aye. Thanks, Mark.
Thank you all. Have a happy
Have a
holiday.
happy holiday.
Great, thank you. All right, let us now go to poor Barbara Durkin. Barbara, drug and alcohol, we have 2 motions. Motion to create a new position of a certified recovery specialist at a salary of $26,000, and a motion to increase the salary of the fiscal technician from $36,864 to $38,864. Barbara?
Good afternoon again. It's been a long day.
Yes.
I really fast just wanted to say that my staff are also very happy with the move to the government center. So I second Bill Browning's comments. They love the space. They appreciate being there. It's very clean. It's very nice. So my staff are very
Did
supportive.
they like
of
the
it.
elevator better?
Oh yeah, yes. Yes. Coming from the electric building, yes, the elevator is much better. So we're pleased with the move. We appreciate the support.
Thank you.
I'd like to make
We
a
knew it
motion.
was a winner. It
Yeah,
was going to work out nice.
Absolutely. I'd like to make a motion to create a position of a certified recovery specialist at the salary of $26,000. Again, this would be a grant-funded position that would, all the funding would come from the Department of Drug and Alcohol Programs, and it's a pass-through.
Okay, does anybody have any questions?
Yes, I have a few, and I'm sorry that it is a long day and I have to put you through this, but, oh well. So this, as we talked about in work session, is from the Obamacare increase for medical assistance, increasing to 133% above the poverty limit for citizens of our country, right?
Correct. When medical assistance expanded as part of the Affordable Care Act, it freed up additional resources at the state to provide more resources to the counties to expand their services.
Right, because what had happened to the public is federal and medical assistance and Medicare were combined, putting HHS in control of all this, which never was happened before, which allowed the government to take money out of our Medicare, which we take out of our paychecks and pay for the website and some of the programs they're having, which includes medical assistance expansion. Medicaid is medical assistance, is welfare. So this is something that I applaud Barb on the work she's doing, obviously, but I think that, this wasn't the intent, was to cover for just drug and alcohol. They were looking at nursing homes as well and increasing the number of people that are on medical assistance. I myself lost my coverage when this law went into effect, the Obamacare law, because my plan was $150 a month. I didn't need child care because all my kids were growing up and out of the house. I didn't need maternity. I won't expand on that. I will just say I didn't need it. And I chose what my plan would cover with my insurance carrier. And that's the plan that worked for me. I chose the doctors I went to, and that's the plan that worked for me. And it was $150 per month with a $250 deductible on an 80-20 plan. And that was in the year before Obamacare was passed. That was my plan. That was my policy. That was a great policy for me and for many, many, many other single people that I know that are in my age bracket. When the healthcare law was signed into effect, that became an illegal policy because it didn't have the 10 essential coverages in it, which were maternity, which I didn't need, child care, psychology care, and all this. There's 10 of them. And so then they just dropped my plan. And I couldn't sign back up until the next year because it was after the enrollment period. And every single insurance company across the country had to abide by that enrollment period. And mine wasn't taken into effect until April, so I passed that March 31st deadline. So I went without insurance until January the following year because of that. And it offends me greatly when I hear about the people that are going to possibly lose their insurance if this law is repealed. There are 322 million people in America today. 20 million is a very small number in regards to that 322 million people in America today. And they try and make that sound like a large number when I can guarantee you people like myself that lost their policies because of that law were a much higher number, and I'd like to see that number actually. Of those people that lost their insurance, some were put on medical assistance, and I am very offended by that as well because I fought my way out of that public system, that public welfare system for years, and I didn't want to be in it. I didn't like it. I didn't like the care I received, and I don't think that we should be mandating it as something that we want to give to all of our citizens rather than an insurance that they choose on their own at an affordable cost that they choose on their own. I resent the fact that they want to get rid of my Medicare that I have already put into for 54 years and put it into a medical assistance program for me to be put into, a system that I fought my entire life to be out of. So, there's so many things wrong with the healthcare system that I do not appreciate, and I wish that people would be talking about this kind of information rather than talking about things that are just these little talking points that sound really nice, but in fact are not as accurate as they pertain to be. And I wanted to talk about this more in our other meeting, but I cannot not talk about this now. And it's highly offensive to me that people like myself are being drowned out by the political talking points that mean nothing to small business owners who have to go out and purchase their own private insurance, mean nothing to single people who have to go out and provide for themselves and their own insurance, mean nothing for waitresses and service industry workers who have to go out and provide their own insurance on their own and pay for it, and who, by the way, have to manage their tips and maybe put on and off medical assistance depending on the month and how much they collected. It's a horrible system, and people need to start waking up to the fact that talking points mean nothing. And unless you understand what it is, please do not let people think that they do, because they obviously don't for anybody that would support this bill. Thank you very much. Sorry. I do support what it covers on your program, though.
Thank you.
Okay, Barb, so you made the motion. Do I have a second? Do I have a second? All in favor? Aye.
No.
Okay. 18-3038, Barb?
Again, I make a motion to increase the salary of a fiscal technician from $36,864 to $38,864. Again, this is a fully state-funded position as well as the benefits. This particular person, Mary Pullman, has been with the county for over 20 years and has never received an increase and has really stepped up to the plate over the past couple months when we've needed her, when we've had staff out. So I make that motion.
Okay, any questions? Okay, do I have a second?
I'll second that.
Okay. All in favor?
Aye.
Okay,
Thank you so much.
John, you're on for commissioners.
Happy holidays.
Thanks, Barb.
Next, we'll bring up the treasurer. Last but not least, Eddie, we have three motions from the treasurer's office. A motion to increase the salary of the deputy treasurers from $49,198 to $50,198. A motion to change the title of the accountant bookkeeper to accountant at a salary of $35,837. And last but not least, a motion to accept salaries as presented in the 2019 budget. Eddie?
Good afternoon, Ed.
As we discussed at our work session, the items that I'm proposing result in over $4,200 in savings annually to Lackawanna County. So first, I'd like to make a motion to increase the salaries of the deputy treasurers from $49,198 to $50,198.
Does anybody have any questions for our treasurer? Okay, do I have a second?
I'll second that.
All in favor?
Aye.
18-3046, a motion to change the title of accountant bookkeeper to accountant at a salary of $35,837.
Do we have any question for our treasurer?
That's
Okay.
the salary that's coming down from what it was.
Yep.
Can I have a second?
Second.
All in favor?
Aye.
Aye.
And finally, I'd like to make a motion to accept all the salaries as presented in the 2019 budget for the Lackawanna County Treasurer's Office.
Does the board have any questions for the treasurer? Okay, can I have a second?
Second.
All in favor?
Aye.
Merry Christmas, everybody.
Thanks.
Thank you, Eddie.
Thanks, Eddie.
And last but not least, on behalf of the Commissioner's Office, we have two items. Item 183035, a motion to change the title from Assistant Chief of Staff to Community Outreach Manager to take effect January 1st. That is changing back the Assistant Chief of Staff position to the Community Outreach Manager.
Okay. We have a motion. Can I have a second?
Wait, can you change the title of Assistant Chief of Staff to Community Outreach Manager?
It's what?
Oh,
Fran's
wait.
title is. It's Fran's old title.
Oh, okay. You got to remind me of this, because
Okay.
Okay.
All in favor?
Aye.
Aye. And last but not least is a motion to accept the salaries as presented in the 2019 budget. I'll make the motion.
Okay. Do we have a second? All in favor?
Aye.
Okay.
All the items on the agenda, Commissioners.
Public to address the board, members of the business. Can I have a motion to adjourn?
I'll make the motion.
Have a second?
Second.
All in favor?
Aye.
That wasn't too bad.